Hello, I'm Dr. Michael, and I'll be talking about a few of the risk factors for hypertension. Hypertension is a condition that is affected by a number of things that will increase the risk of developing disease, and it can be divided into things you can do something about and things you cannot do something about, also known as the modifiable and the non-modifiable risk factors. So I'll begin by talking about a few of the non-modifiable risk factors, which would include things like your age. With increasing age, there is increasing risk of developing hypertension. And also your ethnicity is also a non-modifiable risk factor. People of African descent are known to have high risk of developing hypertension. Your genetic factors or family history is also one, in which if you have a first degree relative that has hypertension, you have a higher risk of developing the condition. Okay. So now we'll be talking about a few of the modifiable risk factors, like your lifestyle factors such as your diet. It is known that diet that is high in salt and low in fruits and vegetables increase the risk of developing hypertension. There are also certain substances that the consumption of such substances can increase your risk of developing hypertension. We have medications such as medications called non-steroidal anti-inflammatory drugs or NSAIDs and many others. Time will fail us if we have to list all the risk factors of developing hypertension, but one thing we know is there are a number of things that you can do something about, and management is targeted to changing your lifestyle and also avoiding many of these substances that we've mentioned before. This will reduce your risk of developing hypertension, even though there are other risk factors that you cannot do anything about.